To go with the idea of segmenting, let's talk for a moment about multimodal communication or presentation. We know from the learning literatures that concepts are most easily learned if they can be accessed in a variety of ways: auditory, verbal, visual, kinesthetic, etc. We can also think about our own personal experiences about how concepts may have been easier to internalize if we have an example or analogy along with the information. So let me practice what I preach here and give you an example. I myself have seen a specialist who does this very well. We'll call him Dr. Murray. Every time I see Dr. Murray, he whips out a piece of blank paper and a red pen. I don't know why it's red, but it's always red. And he draws out what he's telling me. It might be a graph or a simple two numbers to compare against each other, or a couple of bullet point phrases. And when he's done, Dr. Murray hands me this piece of paper, but rarely do I need to refer back to it. I've remembered the points he's made during our conversation. And I understand the details of the concept better than previous clinicians I've seen about this particular health concern. Metaphors and analogies can also be useful ways to explain complex ideas. Here's an example. I work with people with post-stroke aphasia, a language impairment. One metaphor that is useful, it's not perfect, is to explain aphasia this way. For some people, aphasia is a little like traveling to Spain and trying to remember the Spanish you've learned in high school. Again, these are shortcuts that help make complicated ideas more accessible and memorable.